Hi, I'm Emma,
And I'm Rachel.
and today we'll be talking about fibrodysplasia ossificans progressiva.
Our patient is named Susie. Um, Susie is a white 8-year-old female who came in um, with a flare-up and is suspected of having fibrodysplasia ossificans progressiva. Her dad has this disorder as well, and it is a genetic disorder. Patients with FOP have many musculoskeletal symptoms, as the disorder is characterized by the soft tissue turning into bone gradually. She was born with malformed big toes, but otherwise did not begin showing symptoms until she was 6 years old.
A little bit about her medical history. She was born with malformed big toes at birth. It is a congenital defect. She also presents with some mild scoliosis, which you can see in the photo to the right. She also has some flare up and ossification of her right shoulder at 6 years old, which was one of her first symptoms. And that has now continued until she's 8, off and on flare ups. She also has had multiple influenza flare ups, and so she has now started a prophylactic antibiotic therapy due to the risk of respiratory infections in people who have FOP.
Some of her medications and symptoms. Susie is currently on no medications, but her symptoms include episodic flare-ups, which consists of extreme inflammatory soft tissue swellings, limited movement as well, and the malformed big toes, as you can see in the image to the right.
Upon her initial assessment, it shows that she has some limited range of motion and muscle strength. She also has the short big toes with her deformity at birth, as well as the chronic swelling in her right shoulder, which appears like a tumor. She also has kyphosis and mild scoliosis upon her back and spinal assessment.
We did some genetic testing um, on Susie, and she showed the missense mutation in the ACVR1, making Susie positive for fibrodysplasia ossificans progressiva.
Here is our pathomechanism map. As you can see, the missense mutation in the ACVR1 gene is the etiological agent for this disease, which causes the initial injury of bone morphophagenic protein signaling, which that pathway increases, which turns the soft tissue into bone gradually. That leads to defective tissue function, where the mesenchymal stem cells and osteogenic cells increase, which also leads to defective organ function, where heterotropic ossification of the muscles, tendons, ligaments, fascia, and aponeurosis occurs, which leads to systemic effects, including ribbons, sheets, and plates of heterotopic bone throughout the body and joints. All of these cause the main symptoms of the disease, which include painful and recurring flare-ups of soft tissue, restriction of movement, thoracic insufficiency, jaw ankylosis, and spinal deformities in people with FOP.
Our recommended treatment and plan for FOP include medications like Sonos, which is a newer medication. Sonos is indicated for the reduction in volume of new heterotopic ossification in adults and pediatric patients aged 8 years and older for females and 10 years and older for males with fibrodysplasia ossificans progressiva. Individuals may also benefit from occupational therapy, and special shoes, braces, and devices to aid in walking. They also may benefit from weight-bearing activities to help with the activities of daily living. Another medication that is helpful is prednisone, that because it can be used for flare-ups to decrease inflammation. But prednisone has more immunosuppressant adverse effects because it is a glucocorticoid. You should also avoid all activities where trauma is a risk factor, including biopsies, IM injections, or injections of local analgesics.
Okay, our first NCLEX question is, a patient comes in with a diagnosis of fibrodysplasia ossificans progressiva and is susceptible to infections because of previous respiratory complications. Which medication would be most appropriate? A, prednisone, B, dexamethasone, C, Sohonos, or D, aspirin? And the answer would be C, Sohonos. Both A and B have immunosuppression effects, and D was just there to throw you off.
Our next NCLEX style question is, which symptom of FOP is commonly found at birth? A, sarcomas, B, malformed big toes, C, neuropathy, or D, bruising. And the answer was B, malformed big toes.
Thank you, and here are our sources.